Even after hymen restoration, they may or may not be bleeding even after the first attempt of sexual intercourse. Hi, I'm Dr. Ruchi Tandon. I'm a trained cosmetic gynecologist, and today I'll be talking about two surgical procedures which we commonly do. The first is labiaplasty and the second is hymen repair. Both these procedures are done in general anesthesia, and in both the procedures the patient can go home in the same day. Now, what are the indications for labiaplasty? There are basically three main indications. The first is hypertrophy of the labia. Ideally, this should be confirmed by a trained cosmetic gynecologist. The second reason is if the patient feels that she is unable to do sports or physical activities because there is irritation between her labia. And the third reason is, of course, aesthetic or a smoother appearance of the labia. In all these procedures that I'm going to be mentioning, it is important to openly discuss what all you will be undergoing with your gynecologist. And most of these procedures are done in daycare and under general anesthesia. The complications, if done by a trained cosmetic gynecologist, are very rare, and the healing time or recovery is about 4 to 6 weeks. During this phase, you are asked to abstain from sexual activity, and you can go to your day-to-day work. There is no need of rest in any of these procedures. The second procedure that I will be talking about is hymenoplasty or hymen repair. Hymen repair can be done under local anesthesia or it can be done under general anesthesia. In a lot of the younger population, there is a loss of hymen tissue, the most common cause being sexual intercourse. And of course, there can be other reasons as well. Because of physical activity, there can be loss of the hymen tissue. Hymen is a small membranous ring that is present around the vagina, and it is highly vascular. Usually, while the hymen is torn, there can be some amount of bleeding, but this is not mandatory. Now, it is important for the patient to understand that hymen repair is just to restore her confidence, and mostly the reason should be from the patient rather than the surgeon indicating it. There are many communities where the intactness of the hymen is mandatory or is preferred before marriage of the girl. But I want to just bring about to our viewers, even after hymen restoration, they may or may not be bleeding even after the first attempt of sexual intercourse. The total time taken for hymen repair procedure is half an hour, and we use very fine or delicate suture material which is easily absorbed within about 10 to 15 days. There is no need of rest. A course of antibiotics is given and a follow-up of 1 week is needed. Most of these repairs, if done by a skilled surgeon, are barely noticeable by the patient or by another person. And the idea is to make the physical appearance as aesthetic as possible and to ensure good functionality and a good quality of life to the patient.